The district has seen more than 14,000 positive cases of COVID-19. Half of those have been among African Americans, making them more than twice as likely as white residents to catch it. And despite making up less than half of the city's population, they've accounted for 3/4 of the city's deaths.
If the pandemic was looking for the perfect place to strike, to ravage through like a wildfire, it found us.
Troy Pretwood is a neighborhood commissioner for Ward 8 in southeast Washington, D.C., where a third of families live below the poverty line. The ward leads the city in rates of cancer, heart disease, diabetes, and other conditions, and now it has the highest number of deaths from COVID-19, too. One of them was Curtis Orr, a 55-year-old immigrant from Trinidad who started his own dental business. He was Troy Pretwood's cousin.
He simply was a working man. He had a staff that was also working. And he was doing the right thing, living the American dream. And he got sick, like so many other people.
Why do you think more Black people are dying of the coronavirus, especially here in Southeast D.C.?
It's because Southeast D.C. has often been left behind.
He says that like Latinos in Northern Virginia, many African Americans here work in jobs they just can't do from home, depend on public transportation to get around, and live in multi-generational homes. And he said some in the community have become complacent about wearing face masks and social distancing. With only one grocery store in the entire ward, many depend on corner stores and fast food, high in salt, sugar, and fat. That combination of higher infection rates and higher rates of underlying health conditions has been deadly.
In addition to all the other challenges I mentioned, we also lead the city in violence and homicides. Right now, homicides are up in our neighborhood and in our communities. So if that is an example of how we're coping, we're not coping well.